So we are going to talk about some practical tips of excessive tearing in dry eyes. This is the whole reduction and drainage system. As you can imagine, for tearing or epiphoria, this either because of overproduction or fail to drain. For increased production, it's mainly because of stimulation. This could be a reflex response because of dry eyes or due to other irritation. In fact, the most common cause of epiphoria is actually dry eyes. Any blockage along the drainage system can also cause epiphoria. In fact, the second most common cause of epiphoria is nasolacrimal duct obstruction, NLDO. The drainage system actually acts like a pump. As you can see, the punctum, caniculus, and lacrimal sac is surrounded by the lid muscles. So if the lid is malpositioned or the muscle tone is reduced, the system can no longer pump the tear out properly. And that happens in Zephyr palsy and ectropion. Just to show you how the drainage system works, so you need proper contraction of the orbicularis oculi. When you blink, that forces the tears down the nasolacrimal duct. As I said, dry eye is the most common cause of epiphoria, so the epiphoria is usually bilateral and associated with dry eye symptoms, such as foreign body sensation, grittiness, or just generally the patient feels that the eyes are dry. They might have on and off blur vision. This is because the tear film dry up or break down, and the blinking improves the tear film again and vision becomes clearer. We tend to blink less when we are staring at screen. That's why the symptoms could be worsened when using computer or the phone. Now, if there is red eye, pain, photophobia, or if the patient gets sensitive to wind blowing into the eyes, then the dry eye is probably more serious. Severe dry eyes can threaten vision, and we may need to consider investigating for other systemic condition. The tear film is composed of 3 layers. Don't worry too much about the details, they are here just for your reference. Basically, you have the most superficial phospholipid layer, which is mainly produced by the meibomian glands in the eyelid margin. This layer is important because it stabilizes the tear film, covers up the tear, and prevents it from evaporating. Now, the central layer is the aqueous layer, mainly produced by the lacrimal glands. It constitutes the main bulk of the tear film and primarily consists of water and other essential components. Then you have the deepest mucin layer, produced by the globule cell in the conjunctiva. Again, this stabilizes the tear film, and if you like, it holds the tear film nicely onto the surface of the eye. Basically, anything that affects the lacrimal glands, the meibomian gland, or the ocular surface, hence any of those 3 layers of tear films, can lead to dry eyes. Again, you don't need to remember all the details. The point of this slide is to show you that there are many causes. Dry eye are mostly multifactorial. Of course, age-related dry eyes is very common. Other common causes are blepharitis, disorder of lid aperture, low blink rate, drugs, contact lens wear, and allergic conjunctivitis. Rheumatological diseases such as rheumatoid arthritis and SLE can also lead to dry eyes. The management of dry eyes can be very complicated. Basically, we try to target the cause of dry eyes, but that is difficult because it is usually multifactorial. Treatment is mainly about lifestyle modification using lubricating eye drops, and there are the preservative or preservative-free options. I've listed up some of the options here. They are mainly for your reference. Basically, we could step up some of the treatments if the condition is serious, such as using anti-inflammatories. Eyelash disorder can also cause tearing. Most of the time, we just use the term trichiasis. However, there are more specific terms, and I'm listing them out here for your reference. Basically, you just need to know that the eyelash direction can affect the cornea at various degrees. Treatment is quite simple. Blepharitis could lead to trichiasis, so we need to manage blepharitis in order to prevent it. You can appellate the trichiasis. Other options include cryotherapy, lash root straphination, photoablation, and argon or dial laser. We might need to do eyelid surgery if it is lid positioned that causes the problem. MGD, meibomian gland dysfunction, is usually called blepharitis. It is a chronic diffuse abnormalities of the meibomian glands. As a result, that causes obstruction of the duct and alter the tear film quality, and that leads to evaporation and disturbance to the tear film integrity. So the oils accumulate at the lid margin, causing bacterial colonization. They give out exotoxin, and that causes chronic inflammation and eventually irreversible damage to the meibomian gland. Clinical features include symptoms of dry eyes, grittiness, crusting, foreign body sensation, and on and off redness. If you search the guideline, they will tell you all sorts of different stages of treating MGD. Too complicated, forget about them. Now, the treatment is usually conservative, so teach the patient how to do proper lid hygiene, warm compression to help mobilize the clog-up oil, lubricating eye drops, sometimes topical antibiotics, steroid, cyclosporine, even oral tetracycline and macrolide. Thermal pulse and intense pulse light may also help. Finally, just briefly about NLDO. It is usually idiopathic. Clinical features that may suggest NLDO include persistent unilateral epiphoria, lack of dry eye symptoms, tear marks on spectacles because there are so much tears that spill onto the glasses, periorbital skin changes, purulent discharge, especially when you apply gentle pressure over the lacrimal sac, and history of acute decholcystitis. Treatment is surgical, and nowadays, at least in Hong Kong, endoscopic decholcystorhinostomy is preferred, so the endoscopic DCL. So there is no external scar. These are the references, and that's it about excessive tearing. Thank you.